Well, the peak of the coronavirus outbreak in the UK could be a couple of months away, according to the Health Secretary Matt Hancock. He confirmed that Parliament would remain open, despite the Health Minister Nadine Dorries testing positive for the virus and two more ministers, including a member of the Cabinet, deciding to isolate themselves today. Earlier, the World Health Organization confirmed that the coronavirus outbreak is a pandemic spreading in multiple countries at the same time. 456 people are now confirmed to have the virus here in the UK. More than 27,000 people have been formally tested, and that operation is set to be extended, with the number of people being tested expanding from 1,500 a day to some 10,000 a day. Our health editor, Hugh Pym, has been to visit one of the centres processing the samples in central London.
Coronavirus testing is already underway at this laboratory run by North West London Pathology Services, part of a major expansion of testing in England, bringing in hospital labs to help cope with an expected rise in the caseload. There was one more added to the number with news the Health Minister Nadine Dorries had tested positive, the first MP to contract the virus. The government says Parliament will remain open. Officials are tracing her recent contacts. A member of her staff has tested positive. There'll be a significant increase in testing capacity using hospital labs like this. Public health officials say the tests are not for anyone who might feel they're ill. They're specifically targeted at those seen to be most at risk, and only after decisions made by NHS 111 or doctors. So how does contact tracing work? If a person tests positive for the virus, public health officials identify their close contacts in recent days. They're looking for people who've spent at least 15 minutes at a distance of less than 2 metres. Then they decide who's low risk and who's high risk, depending partly on their age and underlying health. Low-risk individuals take no action, while those at high risk stay at home for 14 days, and if they have symptoms, call 111.
It's often family members, because obviously you're living very closely together, so family members will be contact traced. In different situations, it'll be people that you've been very close to, that you've maybe had a close conversation with. That's when you're most likely to have been infected.
Travel insurance has been hit. LV said it was temporarily halting sales of new policies after travellers scrambled to try to protect themselves against cancelled holidays or being stuck abroad. 2 other companies have restricted cover. And a coronavirus case in a Hampshire care home has been confirmed. The council said there were rigorous infection control procedures. It's another reminder of the challenges with controlling COVID-19. Hugh Pym, BBC News.
Well, in Italy, which is Europe's worst affected country, spending has also been increased to help the economy cope with the impact of coronavirus. The Prime Minister, Giuseppe Conte, has also announced the tightening of restrictions, including the closure of all stores except for pharmacies and food shops. Some workplaces, including those essential for production, will remain open. Tourists and visitors can currently leave, but for Italian residents, only those with serious work or family reasons will be allowed to travel. 12,500 people in Italy now have the virus. The number of fatalities has jumped by nearly 200 to 827. Our correspondent Mark Lowen sent us this latest report from Rome.
Because we have the similar...
Connecting the epicenters, a doctor in Wuhan and those in Europe's equivalent, northern Italy. Colleagues in crisis, sharing the know-how. We reached that Italian doctor on the right, in his hospital.
Buongiorno, dottore.
The first to diagnose coronavirus here. It hit like a bomb, but has kept on exploding.
In a very few hours we receive 10, 50, 60, 70, until 200 patients in our emergency department. And we had some hours where the oxygen supply sockets were insufficient to give oxygen to all the patients. So we were in a sort of, let me say, war scenarios.
But in his town, it may have peaked. With no cases there in the past day, it could be a sign of containment working.
I think that what we did in this area has clearly demonstrated that we are on the right pathway. So I think I'm quite optimistic, I'm quite confident that this could be the right way to go.
But the rest of Italy is days behind, and the virus is still surging. Rome is quiet, with limits on movement. Under new restrictions announced tonight, companies must close departments not needed for production, and all shops except for food stores or pharmacies will be shut.
Well, you can see here how the measures are affecting daily life. Pharmacies are only allowing customers in one at a time. At the next door cafes, tables must be a metre apart. They will close at 6 p.m. And if you come over here, you can see the children's playground over there is closed, as are schools, universities, cinemas, theatres, and so many other venues.
It's still scheduled.
Several airlines have stopped flights in or out, a concern for Brenda and Andrew Samuels, booked to travel to Manchester tomorrow. Their hotel here is shutting on Friday for lack of customers.
I'm not worried about the disease. We're taking all precautions that we can, but we're worried about going home, whether our flight will still get us home.
Police have a new target: traffickers of hand gel and face masks, cracking a ring that tried to make a huge profit, like prized drugs, in these dystopian times. Mark Lowen, BBC News, Rome.
Well, still with the coronavirus crisis, in South Korea, a network of nearly 100 laboratories has been set up and tests done on more people per capita than anywhere else in the world. Our Seoul correspondent Laura Bicker has had exclusive access to one of the super labs where thousands of tests are being conducted every day.
Getting critical patients to hospital is a race against time. They have to be tracked and tested quickly. So in this battle to contain the contagion, these labs have become the front line.
So because of the safety, we are not going to go into this room. This is where the samples are being opened and prepared.
They're testing up to 20,000 people a day, more than any other country in the world. A lesson learned from bitter experience with previous infectious diseases.
So is this the busiest you've ever been?
Yes, this is my busiest day.
The computer program can tell whether the sample is positive or negative for the virus.
How long does the process take?
The whole process takes about 5 to 6 hours.
Wow, so it's quite quick.
I think it's quite quick.
Yeah.
Scientists believe early testing and early treatment could be why fewer people are dying here. Makeshift clinics such as this one are set up to combat mass infections. Nearly 100 staff at this building in Seoul contracted COVID-19. Now everyone who works here will be tested. There's no shortage of kits. They were mass-produced to prepare for this outbreak. The blood of recovered patients, like Mr. Lee, is also being monitored in the hope of finding antibodies and potentially a vaccine. Lee told me he had almost no symptoms, just a little cough.
It's really important to be cautious and safe, but I wish people would have less fear of the virus itself. But I also know those who are older need to be careful.
While they appear to be containing this outbreak for now, they know that with coronavirus, there's no room for complacency. Laura Bicker, BBC News, Seoul.
In another development today, the World Health Organization said it now regarded coronavirus as a worldwide pandemic. And tomorrow, the UK government will set out more of the measures that it is considering taking. Our health editor, Hugh Pym, is with me. So let's take stock. Hugh, where are we tonight?
Well, Hugh, the WHO move, I think, is just official recognition of what's been known for a little while now, that this virus is spreading rapidly in many countries. The WHO says it's deeply concerned about the low level of action in some countries and has called for much more concerted international activity to tackle the virus. So what does it mean for the UK government? Not a lot in practice, but I think it gives them the cue if they wish to move to the next phase of the action plan. And I think we will learn more about that tomorrow. The Prime Minister Boris Johnson, he will chair a meeting of the COBRA committee. Then I think we'll get more guidance to people on how to self-isolate if they feel ill, maybe more guidance to older people on whether they should leave home. And all this at a time when the health department's pretty depleted. Nadine Dorries, as we've heard, is recovering with the virus. Her colleague, Ed Arger, has gone into self-isolation tonight on the advice of health officials. So too a cabinet minister because of meetings with Nadine Dorries.
Hugh, many thanks again for the update. Hugh Pym there, our health editor.